Welcome to Chillin' 101. We hope this video helps.
You start by ensuring safety and connecting quickly. Ask directly about suicidal thoughts, plans, and access to means, document responses. Once cleared, introduce yourself, explain confidentiality limits, and invite the patient to share what brought them in. Use brief, empathic reflections to show you understand. Make clear, mutual goals for this session and get consent to proceed. This immediate combination of safety check and rapport allows you to move into assessment without delay while keeping the person secure and heard. Next, you conduct a focused assessment to form a working formulation. Ask about onset, duration, severity, sleep, appetite, concentration, and pleasure loss, and then explore how these affect daily functioning and roles. Once you have symptom detail, inquire about substance use, medical issues, and current medications that could contribute. Summarize the pattern aloud and propose a simple formulation: what maintains the depression and what strengths exist. This shared understanding guides your collaborative plan and helps prioritize interventions efficiently. Finally, you create a clear, collaborative plan that the person can follow. Propose immediate actions like a written safety plan, small behavioral activation tasks, and discuss options for therapy or medication referral. Explain benefits and trade-offs so they can choose. Make specific, measurable goals for the next week and arrange follow-up within 1 to 2 weeks. If things go wrong, troubleshoot by asking about barriers, contacting supports, and escalating care if risk rises. Confirm understanding and leave them with crisis contacts and hope.
Thanks for watching. Consider subscribing if we helped you.